Greetings, everyone. My name is Denise Young, and today we'll be discussing fall risk assessment concerns at Sunnyland Medical Clinic. As the informatics responsibility for overseeing documentation, tools, and data quality in Sunnyland Medical Clinic, I understand the clinical role in accurate and comprehensive data plays in maintaining the regulatory compliance and ensuring patient safety. In our Accountable Care Organization, ACO, the Provider Effectiveness PE report is a pivotal tool for monitoring and improving the quality of care provided. Recently, the site manager approached me with concerns regarding the clinical performance in the area of fall risk assessment, which is a vital quality measure. Sunnyland Medical Clinic has a strong commitment to providing high quality care to our patients while meeting regulatory requirements. The PE report is essential for assessing our progress towards achieving this goal, and any deviations in performance are cause for concern. The fall risk assessment measures is particularly worrisome as it does not only affects our ACO funding, but more importantly, the safety and well-being of our patients. This insurance may stem from either a provider-related problem or potential flaw in the report's data retrievable progress. In this report, I will thoroughly investigate the issues, identifying their underlying causes, and recommend a solution and address them. Our objective is to ensure that we are capable we capture fall risk assessment accurately and comprehensively in our documentation tools, so we can improve our clinical performance and maintain the highest standard of care for our patients. Workflow overview. Receptionist to patient check-in, nurse provider documentation, patient check-out, provider orders, fall assessment, fall risk assessment. Workflow evaluation. Upon reviewing the clinical's workflow, it appears that the fall risk assessments are a part of the patient encounter process. Patients are checked in and series of tasks are completed, included the assessment of vital signs, medication review, learning style questionnaire, smoking questionnaire, and depression screen. Questionnaires, lifestyles questionnaire, and social determinants of health questionnaires. After these tasks, the nurse is responsible for entering their notes, and sequentially, the provider enters the exam room to greet the patient, review the nurse documentation, examine the patient, place orders, enter a visit notes. This workflow includes a step for a provider enters visit note, including fall risk, which indicates that fall risk assessments are intended to perform during patient encounters. Data analysis. The data from the PE report shows a 0% completion rate for the fall risk questionnaire, which is consistent with the workflow. Where fall risk assessments are expected to be performed, all other risk tasks in the workflow, such as vital signs, medication review, and questionnaires, have relatively high completion percentages, indicating that the clinic generally adheres to the workflow. Defining the issue. Discrepancies between workflow and data analysts, lack of all fall risk assessment captures, impact of ACO compliance and patient safety. The issue at Sunnyland Medical Clinic can be defined as a significant discrepancy between the expected completion of fall risk assessments as indicated by the workflow and the actual completion rate of 0% as reported in the PE report. This discrepancy suggests that fall risk assessments are not consistently being performed during patient encounters, which poses a risk to patient safety and plus the clinical at risk and puts the clinic at risk for non-compliance with the ACO quality measures. Comparison of data analysts and workflow assessment. Data analysts reveal stark contrast between the expected performance of fall risk assessment within the workflow and report completion of rate of 0%. The workflow suggests that fall risk assessments are an integral part of patient encounters, yet the data indicates failure to execute this aspect effectively. Justification. Justification of definition. The definition is justified based on a clear discrepancy between the workflow and expectations and the actual data. The workflow clearly outlines that fall risk assessments should be conducted, but the PE report data indicates a complete absence of these assessments. This misalignment poses a significant risk, both in terms of patient safety and ACO compliance. Immediate attention and resolution is needed. Let's propose a solution. Let's reinforce training and education, automate fall risk assessments, reinforcing training and education. Pros, the solution would focus on educating and training providers and nurses on the importance of the fall risk assessment, the correct use of the assessment tool, and the integration of assessment into the workflow. The cons, it may be time to see improvements and see some providers and nurses may still struggle with compliance due to various reasons, including forgetfulness or resistance to change. Workflow enhancement. The recommendation solution is to automate the fall risk assessment process within the EHR system. Automating the process addressing the issue is the core by ensuring the fall risk assessment are consistently integrated into patient encounters. This solution reduces the risk of human error, ensures adherence to ACO quality measures, and enhances patient safety. While the initial implementation may require resources and adjustments, the long-term benefits outweighs the cons. Automation will streamline the workflow, make fall risk assessments more efficient, and eliminate the discrepancy between the workflow and data, ultimately leading to improvement, compliance, and patient outcomes. Automated reminders are essential to any implementation being integrated and maximized to the best of the customer, the patient, and the doctor's consent. Propose a solution. Automated reminders and recommending the options, efficient and minimizing disruptions, addressing the compliance issue effectively, ensures patient safety. The stakeholders. Our key stakeholders are patients, insurance companies, physicians, and pharmaceutical firms. In conclusion, addressing the concerns raised by the site manager regarding our clinic performance and fall risk assessments is the utmost importance. We cannot afford to jeopardize patient safety or risk losing the ACO funding due to provider efficiency. Through a comprehensive investigation, we have identified several issues and their root causes. The issues range from incomplete documentation of fall risk assessments to potential flaws in the report's data and retrievable process. To rectify these problems, I recommend the malfiltration approach. Provider training and educations offer training sessions, resources to ensure that the providers are consistently conducting and documenting fall risk assessments in line with the best practices and regulatory requirements. Documentation, enhancement reviews, the importance of the assessment tool to make it more intuitive and user-friendly for providers, ensuring that it captures the necessary data points discreetly. Regulatory data audits implements regular audits of the documentation to identify any gaps or any consistencies in fall risk assessments and take corrective action promptly. Report review and enhancements. Collaborate with the IT teams to review the PE reports and data retrievable process and make necessary adjustments to ensure it accurately reflects the fall risk assessment data. By implementing these measures, Sunnyland Medical Clinic can address the identified issues, improve our clinic's performance and fall risk assessments, and ultimately enhance patient safety while securing our ACO funding. We remain committed to delivering the highest quality care to our patients and maintaining our position in leader and accountable care. Thanks so much for your time. Everyone have a wonderful day.